Good afternoon, everyone. Thank you so much for joining us today for this European immunization event. My name is Sarah Taysir Ben Sharif, and I am a practicing emergency physician and freelance health journalist. It's my pleasure to be your moderator today for what's sure to be an enriching event hosted by the European Centre for Disease Prevention and Control to mark European Immunization Week. Now, this year's theme focuses on the key fact that for every generation, vaccines work. Each year, this week is an opportunity for us all to reflect on the vital role that vaccines play in protecting public health, not just in moments of crisis, but across the entire life course. And if the past few years have taught us anything, it's that immunization remains one of the most powerful and cost-effective tools we have. And I, for one, would like to start us off with some good news. So the ECDC launched a really cool new vaccination dashboard today, and there you can see vaccination coverage for HPV and other vaccine-preventable diseases. I really encourage you to check it out. It's really a treasure trove of data. And what the data shows, as a piece of good news, is that we now have 3 EU EEA countries that have reached the target 90% HPV vaccination coverage among girls by the age of 15. And we know that down the line, HPV vaccination plays an essential role in preventing cervical cancer. So this is really positive news. At the same time, the context around vaccination is evolving. We're still seeing the continued impact of misinformation and disinformation, shifting levels of public trust, and some gaps in coverage. So while the science is strong, the challenge now is as much about communication, confidence, as it is about innovation. So today we're going to explore where Europe stands on immunization, what progress has been made, and where the key gaps remain. And we're also going to look ahead at how we can strengthen trust, improve uptake, and ensure that immunization truly reaches everyone at every stage of life. I'm joined by a truly fantastic panel of speakers who bring a wide range of perspectives to this discussion, and I'm very much looking forward to the conversation. So we really want this event to be interactive, so we please encourage you to put your questions and comments in the chat box. We've made sure to leave a lot of time at the end of the event to answer as many questions and comments as possible. And now, before we get started, I just have a few housekeeping notes. First, we are happy to share that we have an AI-generated interpretation function in all languages, so please make sure you use that during the session should you need it. Secondly, just a quick note that the session is being recorded and that the recording will be available afterwards on the ECDC website. And lastly, for those of you who are fans of social media, we really encourage you to share your experiences with EIW and this event using the hashtag EIW2026. So without further ado, I'm excited to get us started. We have 4 fantastic presentations ahead of us. So please join me in warmly welcoming our first speaker, Sabrina Bacci. She is head of Vaccine Preventable Diseases and Immunization at the ECDC, and her presentation is titled Vaccines Protecting Generations, Insights on Measles, HPV, and Hepatitis B from Vaccination Programs. So without further ado, I'd like to hand it over to Sabrina for her presentation. Thank you so much.
Thank you so much, Sarah, and good afternoon to all participants connected from different places across the EU and maybe even beyond. And it's a pleasure for me to be here today to have the opportunity to present some of the latest epidemiological trends from the data that we have collected with the countries, and to reflect together on the opportunity that vaccination give us to protect different generations. And we have published a number of reports today, and one of the reports I specifically want to mention is a report on HPV titled The State of Health of HPV Vaccination Programs in the EU. And it is a report aiming at supporting the EU Council recommendation on vaccine preventable disease cancers that include HPV and hepatitis B virus. So just to start with an overview of HPV vaccination program, that are programs that are targeted to protect our generations from persistent infections of HPV infections that can lead to cancer, including cervical cancers. Today, since 2025, we know that all UEA countries have HPV included in the vaccination program, both for girls and for boys. We described that the HPV vaccination for girls have been programs have been in place for about 20 years, while for boys the introduction is relatively more recent, since approximately 10 years ago. The vaccines are being offered to young children, to children and adolescents between the age of 9 and 13 years, and the majority of countries have also catch-up programs in place. When we look at how the programs are performing, and reflecting here on the girls first, and the specific indicator of vaccine coverage of 90%, which is an indicator that is connected to the elimination of cervical cancer, that this is one of the outcomes we are looking at, we see that we have 3 countries reaching this specific target with specific indicator looking at the last dose of HPV vaccination. But also we have another 7 countries who have reached high coverage for the first dose of above 90% in the last year. What we have observed also from our analysis is that in general the vaccination coverage was higher for the countries that have been implementing programs with a school delivery. And what we also observed that catch-up vaccination coverage was quite heterogeneous between different countries, and also there was more difficulties in summarizing this data. When looking at the boys, the council recommendation indicates that we should aim to a significant increase of vaccination coverage in boys over the years. And we're looking at the data, we see some increase. Here we have displayed the median for this vaccination coverage. But actually the important angle to note is that the countries contributing to this analysis have been tripling actually over the course of the 5 years which we were looking at. So this is something that has to be noted, and of course it will be very important to follow up in the next years how is the vaccination for boys progressing. As part of the efforts of the council recommendation, as mentioned Sarah, the introduction, we are also publishing today a dashboard aimed at displaying vaccination coverage data with selected antigens that we will also expand over time. The dashboard is aimed at displaying countries' data, EU averages, and also against the target. A part of the some sections of the dashboard are also displaying data on hepatitis B. Here we have a visualization giving a snapshot where we are with hepatitis B vaccination in children. Here we're looking at the countries who have reached the target. Here for the hepatitis B, we are looking at the 3rd dose of hepatitis B vaccine, which is given in infancy. And we have approximately 1/3 of the countries meeting this target with the latest data available. Now looking at some other diseases and also the opportunities for vaccination to protect different generations, we have an example from recent data from pertussis. Pertussis is a disease which has really been having a dramatic increase in terms of number of cases in 2023 and 2024. What we saw in the last years is a picture that we know from before. The infants are the one heavily affected. They are heavily affected because of higher risk of complications, high incidence, and also higher risk of death, actually. What we see from the data is that the majority of the infants under 1 year of age that are those that really needs to be protected are actually without a vaccination. So those that end up being having pertussis haven't been vaccinated at all. Data also shows that 3 out of the 4 cases for which vaccination data is available of the mother didn't have were not protected from a vaccination through the mother, through a maternal vaccination. So this is a reminder that additional efforts are needed for pertussis. Moving to another example, pneumococcal disease. Pneumococcal disease, a disease which may result in infections of the blood called sepsis, or a specific type of meningitis, and a disease that is very severe in infants and adults. So we can see deaths in these age groups and a number of complications. These are the age groups that are targeted by the vaccination programs in the majority of the countries. We also, what we see today is that in some circumstances, actually, the programs do not manage to reach high coverage, and especially for the adults, the coverage of the vaccination programs can differ a lot between different countries. And therefore might need further better increased implementation. A last example that we wanted to bring also to really show how vaccination can protect different generations is measles. This is the recent data from measles, approximately 5,000 cases in the last 12 months. And what we see here, it's a lot of light green. As you see, these are the cases that are not vaccinated. So basically, again, the cases that we see at European level, individuals that got measles, these are individuals that were not vaccinated. And the vaccination programs for measles are aimed at protecting children. So these are children that miss the opportunities for vaccination. But we also see cases in adults. The recent data actually show that 1 out of 3 cases were adults. And again, here we see these cases haven't got the vaccine. These are likely individuals that missed their opportunity for vaccination when they were younger. And this is a reminder actually for all of us to check our measles vaccination status, but also to see if we're up to date with the other vaccinations. And concluding, I think we have seen just an overview of different opportunities that we have to protect a different generation from multiple infectious diseases, including infections that can lead to cancer. And a note that from our perspective from ECDC, we continue to look at vaccination programs from a comprehensive approach, looking at surveillance, monitoring the programs, monitoring the COVID coverage, synthesize evidence, and try to inform vaccination programs. I'll conclude. I'll finish here, and thank you for your attention.
Thank you so much, Sabrina, for that fantastic presentation. We're going to have lots of great questions for you, I'm sure. I was particularly interested in seeing that there was generally higher coverage for HPV vaccination in countries with school programs, which really illustrates that we have to go where people are to reduce barriers to immunization as much as possible. I was also more than a little bit concerned about the extent of the rise of pertussis, so that's definitely something to keep in mind. So thank you very much for that great presentation, and we'll come back to you during the Q&A. I'm also thrilled to see so many of you active on the chat from so many different countries around the world, so please do continue sending in your questions and comments in the chat box. I think it's going to be on your right-hand side on your screens. At least that's what it is for me. All right, so next up, we have the privilege of hearing from Rita Figueira, who is Policy Officer at DG Santé at the European Commission, and she'll be sharing with us the EU's vaccination policy from a life course perspective. So Rita, the floor is yours.
Hello, good afternoon, everyone. It's very nice to be here today with you. My name is Rita Figueira. I'm a policy officer at the European Commission at DG Santé. So this is our Directorate General that deals with health matters. And today I'd like to tell you a little bit about our EU vaccination policy and how we look at it from a life course perspective. Okay, so vaccination, of course, is an important form of prevention against infectious diseases. And at the EU level, I have to stress that vaccination policies and programs are still the responsibility of the member states. At the same time, the EU plays an important role in coordinating and supporting cooperation between the countries, especially in the face of any shared public health challenges. So as we know, and despite its success, vaccination in the EU continues to face some significant challenges. So the overall goal of our EU vaccination policy is really to increase vaccination uptake across the EU through a life course approach. And why do I say life course? Because vaccination can no longer be viewed as a childhood issue alone, as vaccination throughout a person's life is increasingly important. So aside from childhood, there are other key moments for vaccination, like pregnancy or older age, when traveling, or if you're suffering from a chronic health issue, for example. It's therefore very important to keep informed at all stages of life, and unfortunately, too many citizens struggle to stay up to date with their vaccinations. To close the immunity gaps, we must also acknowledge that barriers to vaccination are complex and very interconnected. So these are shaped by social, economic, cultural, geographic, and systemic factors that affect different population groups differently. So maintaining public confidence and the trust of citizens in vaccines is also very important. And by tackling all of these barriers together, essentially we continue to work towards equitable access to vaccines for all EU citizens. So this is sort of us and our work in a snapshot. But I also want to mention that at the Commission, we work very closely with ECDC, and so Sabrina just presented some of their important work, and also the European Medicines Agency, or EMA. And both these agencies support the member states in their decision-making around vaccination programs by providing expert advice and evidence-based guidance, as well as very important post-marketing monitoring of vaccines. Okay, next. Yes. So beyond policy coordination, I also wanted to tell you that the European Commission provides some concrete support to the member states through some funding instruments, especially the EU for Health program. So with EU for Health, we can strengthen health systems and support national efforts where there is the most European added value. So in the field of vaccination, EU for Health finances a portfolio of projects that help the member states improve their vaccination policies and practices. And you can see here some examples of projects that are ongoing. And you can see that they can vary from some might be promoting good practices to generally improve vaccination uptake. Others are more geared towards identifying specific barriers or facilitators of vaccination. And sometimes this can be quite simple things like vaccination reminders for citizens or facilitating access to vaccination services. So we also have projects looking at this sort of best practices. We also have projects more aimed at establishing trust in vaccination and reducing hesitancy, and also some that are aimed at reducing inequalities and that aim to improve the health outcomes of vulnerable populations. I also just wanted to mention that as well as the E4Health program, vaccination is also strongly supported through the EU research and innovation programs. So that's currently Horizon Europe, but there were also the predecessor programs. And so you can see here some examples of some projects that are funded by them. So together, these programs show that the EU is active across the full spectrum, so from research to policy to action on the ground. Yes, sorry, slight delay in changing slides. So at EU level, as I mentioned before, vaccination policies and programs really remain the responsibility of the member states. And this is really reflected in the use of Council recommendations as a means to enhance cooperation among the member states and to tackle specific challenges at EU level. So you might be wondering, what are Council recommendations if you're not familiar with them? Well, these are formal documents that are adopted by the Council of the European Union to set some strategic directions for the member states on certain shared interests. So these are not legally binding, but they can also carry some significant political weight and they can influence national policies. And as early as 2009, in the field of vaccination, the member states agreed on a recommendation on seasonal influenza vaccination that included a common target of 75% coverage for at-risk groups. We then have in 2018 another Council recommendation where cooperation was further strengthened because it established a comprehensive framework to generally increase vaccination uptake in the EU. That was its main aim. And it included a variety of actions from addressing vaccine hesitancy to improving coordination. There was procurement of vaccines, supporting research, citizen engagement, etc. And so more recently, the Council also adopted some recommendations on vaccine-preventable cancers. And you can see here that there are also plans for a new one on vaccination as prevention for cardiovascular diseases. But I'll go into this in my next slides. So here I really just wanted to emphasize how much of the work that we do at EU level is driven by these Council recommendations, which are proposed by the Commission, but ultimately adopted by the member states themselves according to what they deem to be the policy priorities and the areas where cooperation between the countries is most needed. Oh, sorry. Okay. So I mentioned vaccine-preventable cancers in my previous slide. Well, cancer is obviously still one of the biggest health challenges that we face in Europe today, and addressing it requires a very comprehensive approach. And at EU level, the answer to this is the Europe's Beating Cancer Plan, which was adopted announced in 2021, where the Commission put forward 4 billion euros for a very ambitious plan to embed cancer policy across all sectors and covering all angles. So as you can see, it goes from prevention to early detection to ensuring the best medical treatment and also supporting survivors and their families. So I invite you to have a look at this online if you're not familiar with this work. Today, however, I just want to focus on prevention, especially one aim of this plan, which is to reduce cancers linked to viruses. So with a dedicated funding from the EU4Health program that I mentioned before, this plan supports the member states in expanding routine HPV vaccination for both boys and girls, so linking in very much with the presentation from Sabrina Bacci before. And the target is really to vaccinate at least 90% of girls and to significantly increase vaccination for boys. So we find this big target here in this plan, and achieving this goal is really important if we want to eliminate cervical cancer and other HPV-related cancers across Europe. And the cancer plan also foresaw a Council recommendation on vaccine-preventable cancers. This is to have a strengthened coordinated action against cancer risks linked to HPV, but also hepatitis B infections, and to improve the monitoring of vaccination coverage across Europe. So you can see that some of this work presented by ECDC is also comes from these same aims of this Council recommendation, which was adopted in June 2024 with these ambitious objectives. So in it, member states are encouraged, therefore, to vaccinate at least 90% of girls against HPV, as I just said, and to increase vaccination of boys. For hepatitis B, member states must meet WHO targets for 2030, which you can see here involves having 90% vaccination coverage for children and newborns, and also 95% screening rate for pregnant women. And to support these goals, the recommendation sets out some concrete actions. It calls for HPV and hepatitis B vaccination to be free of charge and easily accessible, ensuring that the cost and the access are never barriers for cancer prevention. It also emphasizes the need to strengthen communication and actively counter any myths and disinformation, recognizing that trust is essential for success. And finally, it encourages the full integration of vaccination against vaccine-preventable cancers into national cancer plans. So positioning immunization as really as a core pillar of a comprehensive cancer prevention. And to help the member states to implement this, the Commission funded a large joint action via the EU4Health. So this is a very concrete example of how you turn some policy, like a council recommendation, into concrete action. And so if you're not familiar with joint actions, these are very big collaborative initiatives that bring together several member states and other actors so that they can jointly tackle some big health policy challenges. And this one is called SHIELD. It officially kicked off in December 25, so at the end of last year, with a big EU contribution of nearly 20 million euros. So SHIELD brings together a diverse consortium of 69 partners in total, including some national public health bodies, health ministries, universities, etc. It involves 25 European countries, so that's 21 EU member states, 3 candidate countries and Norway. So you can see it's really quite a broad network to ensure a very coordinated and EU-wide or Europe-wide, in fact, approach to infection-related cancer prevention. So with SHIELD specifically, the aim is to reduce cancer morbidity and mortality by implementing some prevention programs for HPV, hepatitis B, but also hepatitis C, HIV, and TB. And it will work to address some important barriers, stigma, and discrimination. So that is it in terms of cancer. I would like to very briefly change gears now towards cardiovascular disease. And so this is just, let's say, a brand new work for us. But as you know, this type of disease is really the leading cause of death and disability in the EU, claiming 1.7 million lives every year. So it's obviously very important. And similarly to the cancer plan, the Commission devised a big, ambitious, and all-encompassing plan that we call the Safe Heart Plan. Safe Hearts Plan, which was announced at the end of last year. So afterwards, please feel free to follow the link and find out more about this plan, which promises to deliver some high impact actions. But for now, again, I just want to stay within the actions for better preventive health, for which vaccination is one of the elements and that is mentioned in the plan. So it is known that respiratory infections increase the risk of cardiovascular disease in high risk and vulnerable groups. And vaccination against respiratory infections, so here I'm talking about influenza, SARS-CoV-2, RSV, and pneumococcal disease. Vaccination against this is an effective measure to prevent cardiovascular complications in high-risk groups. So to give you an example, vaccination against influenza is associated with a 34% reduction in the risk of having a major cardiovascular event. So as an example of how really immunization is a very important preventive strategy. And so one of the flagship initiatives of this plan is to have a Commission proposal for a Council recommendation on vaccination against respiratory infections as prevention for cardiovascular diseases. It's a bit of a mouthful, but you understand really that the aim here is to promote immunization as a measure to prevent cardiovascular diseases, taking this lifelong approach that we were talking about and tackling these high-risk vulnerable groups. So here it's envisaged that member states will be offered some support in identifying target populations for vaccination and in monitoring and increasing their vaccination coverage. So this is brand new work that we are doing, of course, again, together with also ECDC, and which you will hopefully hear more about. So now I would just like to conclude my presentation with a little on communication, especially given today's theme, because one of the major challenges today is really miscommunication and disinformation on vaccines and the impact that this has on public trust. So this is why communication is a central pillar of our European action on vaccination. The Commission has launched already several initiatives to provide citizens with reliable and science-based information. One key tool for this is the European Vaccination Information Portal, where you can find some trustworthy and multilingual content across the EU. We also have had some targeted communication campaigns on some priority topics over the years, and this includes the very nice United in Protection campaign. And you can see here on this slide also one of the nice images that we are currently promoting for this European Immunization Week. And there's this year's theme, For Every Generation, Vaccines Work. So in parallel, a quick mention that our EU agencies, ECDC and EMA, also play a vital role in this by communicating on vaccine authorization, safe monitoring, and vaccination effectiveness in a very approachable and transparent manner. So you can always check out their websites as well. And now, my last slide, very briefly, is dedicated to this European Vaccination Information Portal that I just mentioned, which is our EU website for accurate, objective, and up-to-date evidence on vaccines and vaccination. But most importantly, everything on this website is available in all 26 EU languages. So, of course, I guess if you are listening to today's event, perhaps you already know these key facts about infectious diseases and how vaccines work, but I really welcome you to use and promote this tool in your member states. So in this slide, you just have a little snapshot of the sort of things that you can find, which includes a link to the very useful ECDC vaccine scheduler, which contains the national vaccination schedules in all EU and EA countries, which believe me is very useful. I've used it many times. And there are also a range of resources available in different languages, like infographics or data and statistics, which you can also adapt for your countries, your languages. It's there to be used, so please do and share. And thank you so much for listening today. Thank you.
Thank you so much, Rita, for your fantastic presentation as well. We're really looking forward to the recommendations on vaccinations against respiratory infections as a preventive measure for cardiovascular diseases, because we definitely know that cardiovascular diseases are incredibly prevalent and also a risk factor for any respiratory infections. And I particularly appreciated that you highlighted the essential role of communication, and we really see how important it is to work together to have effective communication on immunization. And we see this with our own event today, which is organized by the ECDC together with DG Santé, the European Commission, and World Health Organization's Regional Office for Europe. So this event is already an example of how essential it is to communicate effectively together. So thank you so much, and we'll hear from you as well in the Q&A later on. All right, a reminder once again to our audience to pop your questions into the chat box. I'm loving the questions you've already submitted, so keep them rolling. So next up, we have with us Lyudmila Mozina, who is WHO Technical Specialist on Vaccine Preventable Diseases and Immunization. And she'll be talking to us about how to boost vaccine uptake towards control and elimination of hepatitis B in the European region. So with that said, over to you.
Thank you, Sarah, and good afternoon, dear participants. And I'm really pleased to participate in this important event, European Immunization Week event. And yes, I will be talking about hepatitis B control through immunization and viral hepatitis elimination in the WHO European region. Hepatitis B remains a significant problem, a public health problem in our region, with more than 10 million people living with chronic hepatitis B infection, how it was estimated for 2022, and approximately 32 people died from hepatitis B complications, liver cirrhosis, or liver cancer. Safe and effective recombinant vaccines against hepatitis B are available since 1986, and they've been adopted by many countries, and WHO first time recommended universal hepatitis B vaccination back in 1991. And up to now, there are 49 countries in the WHO European region that implement universal hepatitis B vaccination of infants, and 23 out of these countries provide universal hepatitis B birth dose. And regional coverage with 3 doses of hepatitis B among infants gradually increased through the years and now reached 91%. In 2022, Global Health Assembly adopted a global health strategies that set a goal to eliminate viral hepatitis. And following this, the countries of the WHO European region adopted a regional action plan that outlined priority activities for countries to reach elimination. And immunization is a key intervention to control and eliminate hepatitis B. However, immunization alone is not sufficient, and the countries should implement comprehensive approach and also intensify other activities such as testing, early diagnostics, proper treatment, blood safety, infection control, harm reduction to reach viral hepatitis elimination goals. The regional action plans also set goals, and with regards to immunization, the countries should increase hepatitis B coverage among infants up to 95%, demonstrate a successful implementation of programs to prevent perinatal transmission of virus, or another name for this is mother-to-child transmission or vertical transmission, and to reduce the prevalence of chronic hepatitis up to below 0.1%. 11 countries in the WHO European region demonstrated the achievement of intermediate hepatitis B control targets that countries should achieve by 2025 through the regional validation process. And one of these countries is Italy. Italy was among the first countries to introduce universal immunization of infants in the world 34 years ago, along with the catch-up vaccination of adolescents. And as the result, individuals at the age up to 46 years are now protected against hepatitis B. And Italy demonstrated consistently high coverage with immunization and interventions to prevent parental transmission of virus. And the impact of 20 years of implementation of hepatitis B vaccination being demonstrated in serosurveys. And at this slide, you can see the results of serosurvey conducted in Tuscany in 2009, 20 years after the introduction. And the prevalence of chronic hepatitis among children at the age between 1 and 10 years was 0. At the age between 11 and 20 was 0.6 compared to 5.1% prevalence of chronic hepatitis B in general population. The age of infection plays an important role in the probability to develop the chronic hepatitis B and its complications later at life. Therefore, WHO recommends that the immunization program should target primarily newborns and infants to prevent them early in their life, through their life course, from the infection. Next. The other two countries, the Netherlands and United Kingdom, are countries that historically had a low prevalence of hepatitis B. These countries also demonstrated the strong program performance, including interventions to prevent parental transmission of virus. And through antenatal screening, they were able to demonstrate that despite the recent population movements from high endemic regions that change the epidemiological landscape, these countries were able to maintain low hepatitis B prevalence. The remaining countries are the countries that historically had intermediate or high endemicity of hepatitis B, which means that from 3 to 8% of their populations were chronically infected with hepatitis B. And with WHO support, these countries conducted population-based representative serosurveys to evaluate the impact of 20 years of implementation of universal vaccination. And they got really impressive results. The prevalence of chronic hepatitis reduced to 0% in countries like Albania, Armenia, 0.1% in Belarus and Georgia, or maximum 0.2% in the remaining countries. The results obtained from these countries will help us to validate the achievement of intermediate hepatitis B control targets in entire region. However, in order to achieve viral hepatitis elimination, the countries need to intensify their efforts to maintain or increase coverage or maintain high coverage, not less than 95% among infants, successfully implement interventions to prevent perinatal transmission. The countries that provide universal newborn vaccination should sustain high coverage. The countries that currently implement antenatal screening should improve this program to ensure that all pregnant women are tested for hepatitis B. Those who are found positive receive treatment, and their children are vaccinated at birth, and if necessary, receive hepatitis B immunoglobulin. But countries also should continue vaccination of adults at higher risk of infection in order to protect them from hepatitis B as well. Strengthening hepatitis B control is one of the goals of European Immunization Week 2030, and WHO regularly publish reports monitoring the performance of national immunization programs and progress towards achieving this goal. WHO provide guidance to the countries on how to increase and improve the performance of immunization programs and increase immunization coverage. And recently, we issued 2 regional guidance on addressing inequities, which is core to the success of immunization program. And these guides help countries to identify the population groups or geographic areas with lower coverage and develop targeted interventions to address inequities. And WHO also issued guidelines on how to establish the catch-up immunization programs to ensure that children and adolescents who miss their routine doses are vaccinated later in their life. These strategies being developed by countries as a response to decline of the coverage during COVID-19 pandemic, but since then have been adopted into routine immunization program by many countries. And WHO also provides direct support to the countries in developing their national immunization policies and strategies, but also in identifying and addressing immunization inequities by conducting facility-level assessments, behavioral studies, developing immunization equity improvement plans. We also provide training for immunization programs on how to use data for action to improve performance of the immunization programs, but also for healthcare workers on how to communicate effectively vaccination with parents. We also continue our work in introducing and evaluating Immune Patrol. It's an interactive game for school children that teach them about vaccination. And at the end, I would like to say that the experience with countries who demonstrated the achievement of hepatitis B control targets highlighted the importance of the life course approach for control and elimination of hepatitis B. The intervention starts with pregnant women health care, continues at birth, reinforced during childhood, and then extend to the adulthood to protect the people at high risk of infection. Thank you very much for your attention.
Thank you so much, Ludmila, for this fantastic presentation. I really echo the comments in the chat that say that your presentation is really interesting. A note to our audience that the presentation slides will also be published at the same link where the recording will be, and the link is posted in the chat. I found it really impressive to see just how the prevalence of chronic hepatitis B decreased after 20 years of implementing the vaccination program in those countries that you listed. So it's really proof of concept that vaccination works. And what I also appreciated is that you really emphasize that even when we reach those vaccination coverage rates, the work doesn't stop there. The real work is in maintaining it. So it's not a one and done success. It's really, we celebrate that success and then we keep going with it because it has to be continuous and ongoing. So thank you very much for this great presentation, and we will see you back during the Q&A for lots of questions as well. Thank you. And now, last but certainly not least, we have the pleasure of hearing from our last speaker, Bolette Suborg, who is head of vaccine preventable diseases at Denmark's Statens Serum Institute. Bolette will be talking to us about the key lessons from Denmark's work in expanding HPV vaccination among adolescents. I'm really excited to see this, particularly now that we have the dashboard with all this great data, and look forward to hearing from your experiences specifically in Denmark. So Bolette, the floor is yours.
Thank you so much, Sarah, and a pleasure to be here, and thank you for inviting me. Maybe if someone have sneak peeked into the new dashboard, they can see that Denmark is actually doing very well on the HPV vaccination. But this presentation is just a reminder that what you see is a snapshot and things can really change, and they can change quickly, and that's why we have to be agile. So the HPV vaccination program in Denmark was launched in 2009 for the girls, and we had the boys along in 2019. And what we did was actually to deliver the vaccine free of charge and do it by the general practitioner's office, and not in schools, as we heard. That is very good, but we don't. And then also using the 9-valent vaccine since 2017. And then in Denmark, we use 2 vaccines for the under 15 and 3 doses for the over 15. So we have not gone off-label for a 1-dose use, which might also be important. And then as a last thing, just to understand the situation in Denmark, we do have a very, very tight overview of our coverage, and also of being able to actually invite our parents. So when a child is born in Denmark, they're actually given a personal identification number. And by that, we actually create a schedule for the child. And then 2 weeks before the scheduled vaccine, you're actually invited for vaccination. And then we measure whether this vaccination is actually done. And if not, then you get a reminder. And then each month we actually do our coverage. So actually, again, we do have a very, very tight overview of our vaccination program. So everything should be swell, but things are not that easy. And I think that's also why this week is so important and communication is so important. So this shows you a graph with the X and the Y axis. And on the X axis, you actually see birth cohorts. So the 2003 birth cohort, you have to plus 12 because we give the vaccine at 12. So we are in 2015. So something dramatic happens in 2015 with the Danish line, which is the red line, which is not happening in our Nordic sister countries. So we do see this tremendous decrease in vaccination coverage. And what was seen there was this TV documentary showing unspecific effects on young girls linked to the HPV vaccine. So we actually acknowledged in Denmark in 2016 that we had an actual HPV vaccination crisis. It's not very easy or very positive to call it a crisis, but it was actually what we did acknowledge. And also that even though we had this very, very close collaboration with our parents and a very trustworthy population, we still had a situation with this vaccine and not anything else in the program was actually distrusted. But what was very unsure for us was whether or not we knew this documentary was the start, but what the real problems on the vaccine was not well understood. So we didn't understand why the parents distrusted our recommendation that much, and what we could do to actually maybe inform or meet them and hopefully turn their minds on vaccination using communication. So what we do was to make a preliminary study to actually inform our campaign. This takes time, and of course it's also costly, but we thought it very necessary. And what we actually did was actually to both use focus groups, interviews with mothers. We made online surveys with both moms and dads. And we also made a media information survey where we looked on what was talked about online, what was the doubt, what was the critique of the vaccine. And that informed us to our campaign. And what we saw was that we needed to target the mothers, because that was the ones who took the decision on whether the girl was vaccinated or not. And also we needed to target the mothers in doubt, because as already there was knowledge out there, particularly from the WHO, that you needed to actually target the ones in doubt, which you might be able to swing. I mean, to change their minds and not talk to the ones who are always already persuaded not to vaccinate. And then it was very, very important to us as well to also to get out there where people were actually discussing things, and that was online, it was on social media. So we needed a presence there, and we needed to have a presence 24/7. So that's what we did, having very, very dedicated online teams asking to be able to take all questions that parents might had, also very difficult questions, also very negative questions, but we didn't rule out anyone. So, and then we also had this very, very close collaboration with everyone that was able to support our cause. I mean, all the medical societies in Denmark, our cancer society, and also other medical communities such as the nurses and so on. And that was very important that we talk with one voice on all our messages coming out of this campaign. And then it was also very important for us to balance our communication with, of course, the scientific input, as we also saw from the European Commission, also going out through our information portals, but also to talk about the personal stories, to talk about the ones who are actually would have benefited from having this vaccine, but did not, because they didn't have the offer at that time where they were young. So this is a woman, and we didn't start at the peak, but we started with small things, talking about women who would say that had I had this vaccine, I wouldn't have had these precancerous lesions. But this woman is actually having a very stage 3 cervical cancer, and is actually she's dying of it, and she still wanted to tell her story, which was very, very powerful and had a lot of reach on our online websites. And then, of course, we didn't only live on the online media platforms, but we also got out into the society, and especially our cancer society, who has a lot of volunteers, 40,000 people who use their spare time to go out and to rally the vaccine at all these different events. It could be like big running events or concerts, and taking the dialogue with people and trying to answer with these messages from the campaign that HPV vaccination was very important. So, and also the last thing, which I think is very important, is that we also try to make the dialogue with the very critical groups. Even though they were not part of our campaign, we did try to reach out, because you should always leave a door open. So I went out and had a lot of dialogue with the critical group, trying to meet them and discuss the possible treatment of their girls. Maybe not that we could discuss the causality of why they were ill, but we could discuss that, of course, there should be treatment options for them. So it was very important for us that this campaign was actually written up, and in partnership with the WHO, we made this small insight pamphlet of our campaign, because we think that being in a country that usually has this very high coverage, even though we saw this decrease in our uptake, and this could happen to other vaccinations, and we were of course afraid that this would be contagious somehow to other vaccines, but it didn't. So we kind of contained it, and it also now we are able to say that we are up again, and we made it to the other side. But it's very important to have these insights. So to the insights of our campaign, we could see that it was very, very important for us that we could actually do our studies beforehand, before going out, so we could find who should be the target persons of our campaign, what are the talks, what do we need to kind of deliver message against, and also that we do it in a uniform way, that we use our network partnerships. And also that we do that if you go online to the social media, you also need to be able to understand the media. You also be able to understand how you should frame your messaging, and also you should be able to also be present when people are actually in need of information. Yeah, and then also the hearts and mind communication on social media. This might not fly well with a lot of us science people. I also have a medical background, but it's just so important that you understand that whenever people make a decision, they are not solely based on science. I don't think that comes as a surprise to anyone. But also, again, being able to also communicate with the heart is not something that most public health institutes or healthcare professional is very used to, but it's just so important if you need to actually reach your target group. So I think I'm at the end of this. I just wanted to show you, this is just our coverage. It's not all up to date, but it's just to show you that even though we had this dip in vaccination coverage for some cohorts of girls, we actually managed not only to get the vaccination coverage up to the cohorts coming after, we also actually managed to get the cohorts who were very low for the 2015, 16 and 17 years. I mean, that's birth cohort 2003, 4 and 5. We actually managed to get them up using those campaign, the campaign that I described here. So I think that was all, and thank you so much.
Thank you so much, Bolette. I really appreciated your presentation. I especially loved the 5 handy tips to plan and carry out the campaign, which is a great way of sharing best practices learned from Denmark's experience. And thank you as well for those tips on how to communicate on social media, because people are certainly getting their fair share of misinformation and disinformation on social media. So it's all the more important that facts and accurate information be present in that space as well to reach the target groups. And I'd like to echo what Gary Finnegan said in the chat, that it's really great to see that we can recover from a crisis when you showed that graph of the dip in coverage, and that we can recover from it and learn from it. So thank you so much for those key lessons. Before we go on to our very exciting Q&A, a reminder that we have an AI-generated interpretation function in all languages, so please do make use of that during the Q&A if you haven't already. I'm thrilled to see so many people from so many different countries around the world, so we're happy to have this option for AI-generated interpretation. And a reminder once again to send your questions into the chat, because we're going to be going through it for our Q&A. So we have just heard from all of our speakers about the great progress that's been made when it comes to vaccine preventable diseases, but as well as the work that remains to be done to boost uptake and even work towards eliminating conditions like hepatitis B or cervical cancer. So with that, I'd like to welcome all of our speakers back onto the virtual stage, as we have lots of great questions that we would like to address. So I'm just going to pop onto the fantastic list of questions here. So I would like to start with a question for Sabrina. So we have Chen Stains Amir, who is asking you, what do you think about switching to a single-dose HPV vaccine?
Thanks, and also congratulations from me, from all the speakers. I think it's been inspiring also to listen here from Stockholm. So in terms of the one dose for the HPV program, so this is something that is being currently quite a hot topic in the literature. From what we see from the European EU perspective, we have 3 countries that are using the HPV vaccine as a single dose in the program. And there has been increasing evidence documenting that the HPV vaccine has a long-lasting effect against lesions that are HPV related. At the same time, this is something that has to be considered in a broader context of regulatory approval, a type of implementation, and really how the program is functioning. So if you think about a program targeting adolescents that have to go 1 or 2 times to get a dose, of course, if you have a program with 1 dose only, this can be, let's say, more simple from a logistic perspective, but at the same time, it doesn't offer opportunity to catch up for a missed dose at the second appointment. So this is something to be considered. At the same time, of course, having a program targeting the adolescents with 1 dose only offers, let's say, the programmatic opportunity of meeting coverage target with the first dose only, because of course we also know that sometimes not everybody will show up for the second appointment. What is important to note is from the population perspective, so all of us or our children that are eligible for HPV vaccination, is important to have a dialogue with the healthcare professional, the nurses, and understand what is your eligibility. And this also can change according to the age, noting that the one dose is something that may be considered for the younger populations, but is something that is not really applicable for catch-up groups and other populations. So this is something that we need to keep in mind. So for our children, our adolescents, and on a note from what we have seen and from the different presentations, and also what is important to do is to continue to monitor how these programs perform, how further the science can be really complemented by studies that are upcoming, and of course adapt our recommendations as we move further.
Thank you very much for this very comprehensive answer. Just want to open the floor to our other speakers if anyone has anything they'd like to add to that before our next question. Yeah, Bolette.
Yeah, thank you. I think as talking from a member state, this is something that is also a hot topic, as Sabrina said, in our country, and discussed by our NITAG in at different opportunities, but also that we are very aware that this has this programmatic positive effect, but also that there is some long-term effects that we still are wanting. So maybe this is it could be interesting to hear the evaluations of the 3 countries that already did this. What did they discuss? Why did they come to that conclusion? Thank you.
Thank you so much, Bolette. Really appreciate it. Our next question is for Rita. So this question is from Catherine Fiore from vitalsigns.news. So Rita asks, Council recommendation on cancer-preventing vaccines say that the ERDF, which is the European Regional Development Fund, and the ESF Plus, which is the European Social Fund Plus, could intervene. Have these funds been used, especially since EU for Health cut 1 billion euros? And there are particular countries like Romania that have low vaccination rates. Can this be targeted in, say, country-specific measures? Is DG Santé, for example, pushing for this with other DGs? Would love to hear your thoughts.
Yes, thank you. Thank you to the person who sent the question in. So these are, of course, other EU financial instruments that can be used to contribute to an improvement of our societies. These are not health-specific instruments like the EU for Health, but they can, for example, include improvement of health systems. So, as you can understand, I am well aware of the work that we are that is being funded by the EU for Health, like the Shield and that I presented, that big joint action, as well as, for example, 3 new HPV projects. For these other funds, I am not aware, at least personally, that they have been requested yet for that aim. But as this listener mentions, it is indeed a possibility foreseen in the Council recommendation. So, but I see that the person asking the question already knows that we have different DGs at the Commission and that these other programs are not directly with us here at DG Santé. These are also very country-led, so they function in a different way. So, for example, regional funds can be applied to by sending in a project, for example. So the answer is, I am not aware that they are yet being used for that purpose, but this is something that may come from your side. And so if you say, for example, that in Romania, you think this could be of interest, well, please follow through and you know, it's good that we have this different financial instruments, but they do work in slightly different ways. So I'm not fully aware of what's being sent in from the member states for those, what requests are being made, but it's definitely a possibility. Thank you.
Thank you so much, Rita. So my next question is for Ludmila. So I was really struck by the improvements in HPV, chronic hepatitis B, thanks to vaccination. So I wanted to know, how can we better support frontline healthcare professionals to have confident, effective conversations about vaccines with patients? And how did you incorporate that physician-patient relationship to improve your coverage for hepatitis B vaccination?
Thank you. WHO Regional Office for Europe developed training materials, actually a training course for healthcare workers on how to improve communication with parents. And it is available on our website, and it is being developed by our communication experts. And this is a very interactive training that includes a lot of interactive communication when participants play a role of healthcare workers, play a role of parent who agrees to vaccinate their child, who is against vaccination, who is hesitant. So through this training, they develop they learn their theory, but also develop practical skills, how to communicate with parents to persuade them that immunization is important. But a part of this communication skill, what I personally think it is extremely important, is to give medical workers data and knowledge about the benefits of vaccination, so they will be persuaded themselves and feel completely, and about safety of vaccine, so they are persuaded by themselves that vaccination is important and needed, and could confidently recommend vaccination to their patients, and they could transfer this confidence to adolescents, to children, to their parents. And we also have a lot of training materials on this topic. We have guidelines on immunization safety. We recently developed a set of training materials on HPV vaccine, which are extremely important still for many countries who are struggling to achieve high coverage. And we also include a lot of information about the impact of vaccination. And I think countries of European region were really lucky to start this vaccination very early, as soon as vaccines became available. So now they implement this vaccination program for more than 15 years. And they publish a lot of data, a lot of information, how HPV vaccination influenced the burden of disease, how in these countries practically disappeared the highly oncogenic types of HPV that cause the majority of HPV-related cancers, how the number of pre-cancer lesions decreased in young generation of women. And several countries also were able to publish the almost disappearance of cervical cancer in young women. We know that the majority of women get this disease later in their life, but there are still cases among young women, and if compared to pre-vaccination era, they completely disappeared. So I think this data also should be disseminated, and medical workers should be provided with them so they will have evidence to communicate to parents, to persuade them that the risk of immunizations are very low, but the benefit are dramatic. Thank you.
Yeah, absolutely. Thank you for that comprehensive answer. You're right that, we have to be armed with facts and also an understanding of the emotions that go behind vaccination. So absolutely essential to be well-informed, to have those conversations with patients. It's something that I do as well in my clinical practice. And just as an example to share with our audience, I'm sure this is in other countries as well, but in my country, Canada, there is a VaxFacts clinic run out of Scarborough, which is a city within the area of Toronto, and it's a colleague of mine who started it. It's a vaccine hesitancy clinic, so people who are hesitant or have questions about vaccines, maybe don't identify as vaccine hesitant, they can go to this clinic and book appointments specifically and exclusively to talk through their questions, their concerns. So really important to have multiple avenues and spaces where people can feel comfortable discussing things. So I'm going to go on to another great question that is open to everyone, all of our panelists. So just raise your hand and I will call on you. Paolo Cardone asks, what are the most efficient strategies for reminding people about vaccination over lifespan? Taking inspiration to the role of schools in HPV vaccination, are there any pilots on proposing vaccination in workplaces? Great question. I can already think of an example during COVID and flu vaccines, at least in hospitals, we do have that. But are there any other examples that we can learn from? Maybe, yeah, Bolette, and then Rita, great. Just one moment, Bolette. All good.
Yes, so thank you for the questions, and I can say that in Denmark that one thing we do use is actually these to be sure that it's easily accessible for all ages, especially the workforce age groups, that to be vaccinated. We do have open vaccination clinics in all of our regions, which are open on these odd hours outside of work. And again, we can use our data linkage system to actually invite some of these people, but of course I know that's not accessible to everyone, but still to be accessible for these hours where people are outside work, and to actually be able to also use places so everyone has a nearby clinic is also very important. And we became very aware of that during COVID, and we kept it for other vaccines for adults.
Yeah, so this is a strategy. While it's not vaccination in the workplace, it's vaccination that's facilitated around typical workplace work hours. That's really great. Rita, you have your hand up.
Yes, just thank you. Just to complement, well, I think this is really a very important aspect, is to really meet people where they are, to avoid this, missed opportunities when it comes to vaccination. Because we are all aware that some people may be anti-vaccination, and that's perhaps, I hope, a loud minority. But there are many people out there who would like to get vaccinated, but people are very busy. They have complicated lives, they have children, they have work. We have to really try and meet people where they are. And I can just point to some of our projects that were funded under EU for Health. There have been some very interesting things. I maybe suggest that people have a look at the project called Overcoming Obstacles to Vaccination, because that one had a very sort of practical approach, like sort of logistics and what are the sort of physical obstacles almost to vaccination. And they looked at certain things like mobile units, or some easier locations for vaccination. There were also programs in schools, but of course we must understand that this is very country specific. So of course, you know, and all of these are, in fact, we have to respect that not all countries function in the same way. They also did something quite interesting, a pilot also with reminders for people, which is something that is perhaps very simple, but can be very efficient. So yes, that's yeah, some ideas, some things that our projects have looked into.
Absolutely, thank you. Sabrina, over to you, and then we'll take another comment from Ludmila.
Yes, we were just reflecting. I mean, and this is something we discuss with countries at all times on the importance of reminders, but also on the different stages of life. So vaccination is delivered in different contexts in different countries. Maybe some vaccination is delivered the baby clinic, some in school, some to the healthcare professionals. So there could be different systems. Of course, for reminders, you need some sort of system that allows you to create a reminder relatively easy. And of course, any type of efforts in that direction needs investment. At the same time, we have experiences from that some of these systems can connect the information with the reminder, with the information if the person gets vaccinated after, and then you can actually have more granular data to understand if, for example, that region, that community has a high or low vaccination uptake, and then of course that can drive some of the interventions that can inform. What I also want to say, and I'm connecting your comments, Sarah, on the vaccination clinic that you have mentioned from your colleague, is that we continue to know today that the healthcare professionals are really the most trusted sort of information for all of us when making a decision on vaccination. So there is the importance of the reminder, and that there is the importance of the dialogue of the citizen with the healthcare professional, and this is really also what is so important and drives often the final decision of the person to get vaccinated or not. And so this is also why we really need to continue to invest in high quality information for the healthcare professionals, modules that can support the dialogue, and also ECDC has a few examples of this type of courses of information, that can be used to organize the dialogue with the patients.
Great. Thank you so much, Sabrina, for this great answer. Ludmila?
I think it's already been told, but I just would like to emphasize the importance of, especially for routine immunization, of these invitations or reminders, or we call it call and recall system. And I just would like to give an example of really excellent HPV vaccination program in Denmark. And we studied experience of first 18 countries that introduced HPV back in 2000s. And we try to compare the countries that achieved really high coverage with the countries who failed to really get a high vaccine uptake. And there were different criteria that we identified, but one of them, I think, was this invitations, active invitations. In Denmark, they sent invitation letters to the families of adolescents, girls, who were the main target group for HPV vaccination. And at that time, we really saw that the countries who did this active invitation really were able to achieve higher coverage. I don't know if Denmark continues doing that. Maybe it's not needed through the years, but the importance of reminding or informing people individually about their routine vaccination, about the time when they can come and vaccinate themselves are also very, very important. Thank you.
Absolutely. Thank you very much. And I have a backup question, follow-up question for you that I'd like to get to. I want to circle back to Bolette now, because we're talking about importance of communication and disinformation and misinformation. I think about this a lot about the amount of disinformation that circulates on social media. And I would just love to hear from you, do you think social media platforms are held sufficiently accountable for their role in the circulation of this misinformation, especially when it comes to teenagers who do spend a lot of their time using various social media platforms? Yeah, what are your thoughts on that?
I think that might be a question that's a bit above my expertise, but I think that it's definitely an extra layer of uncertainty now that AI is summing up everything. When you go in, for instance, and Google something about a vaccine or something, it will sum up something for you, and you don't know what the sources are. And if a lot of concern is being heard, it seems like these kind of concerns maybe not be summed up in the AI summary, but it still will be some of the first ones coming up for you to click on. And all of these algorithms and all of these information biases that is not visual for us is a huge concern. And it seems like that the public health also need to have specialization on these kind of communication, but also on AI to be able to somehow combat or at least try to stem the tide.
Yeah, you're right. It's a very complex question for sure. And it will depend country to country as well, because the legislation is not the same. All right, my next question is for Ludmila. So it's about hepatitis B vaccination coverage. So despite Hep B vaccination coverage in the WHO European region rising to around 91%, why do we still have an estimated 10.6 million people living with chronic infection, and still we have 32,000 deaths every year? And what are the biggest barriers that you've identified to preventing this progress from translating into eliminating chronic hepatitis B and its ensuing complications?
I didn't have enough time to go through entire presentation about hepatitis B. It's a very complicated topic, but we need to understand that hepatitis B infection develops very, very slowly, and the children who are vaccinated at very early age can get an infection and don't have any symptoms. And then later in their life, they develop chronic infection, which is also completely silent. And the people start having problem when they reach kind of serious age with chronic hepatitis symptoms, or even with liver cirrhosis or hepatocellular carcinoma. So we introduced vaccine very early, especially in the countries of European Union, like Italy 34 years ago, but they vaccinated adolescents. So now people up to the age of 46 are protected. However, whomever was born before this period of time, and the general population, 5% of population are still infected with the hepatitis B virus and can develop the chronic disease. They can develop severe complications. Therefore, the country should apply the comprehensive strategies to eliminate viral hepatitis. Immunization is probably one of the main interventions, because you can protect the new generations of children that are born against viral hepatitis B by immunization. And no matter what happened to them later in their life, what kind of lifestyle they will choose, will they be in high risk group, in the group of high risk of infection? Will they become medical workers? They will be protected through their life course, but we still need to detect these chronic cases among all the population, or among those who haven't been vaccinated, although vaccination been offered to them, and also could develop a chronic infection. And especially now when the epidemiological landscape is changing, because people coming to Europe, millions of people from Europe traditionally didn't have very high endemicity of hepatitis B, but now people coming from really, really high endemic regions to live here, some of them also infected. And that's why I emphasize so much the importance of this prevention of perinatal transmission, to make sure that probably young women who came from these regions and give a birth to a child in countries of the double European region, their children will be protected from infection, either from mother or from sibling or from their relatives. But we indeed achieved the 91% coverage, but it's a regional coverage, a little bit like national coverage. It can hide really big geographic areas or groups of population that are not vaccinated, either due to some problematic systemic problems with immunization program, or because their parents refuse to vaccinate their children. So, and what is dangerous, it's like everybody introduced vaccination program works for decades, and people kind of think that we already addressed this problem. And it's really important to remind the countries, the ministries of health, people that we need to make this last step. We need to improve it from 91% to 95% and to make sure that we protect these newborns, no matter in which family they've been born, if their mother infected or not. So this is really, we need to keep this agenda going to finish it. Thank you.
Thank you so much. You're right. It is quite complex and always evolving too. Like you said, the demographics are changing and therefore our approach has to adapt accordingly too. My next question is for Rita. So in your presentation, you mentioned that the European Commission supports the member states in their vaccination strategies. I just wanted to know more from a policy perspective. Where do you think we need to have stronger coordination, whether it's on setting targets or having more harmonized strategies? And what's currently holding back that stronger cooperation or coordination, if anything?
Thank you. Yes, I think this coordination really is very important because it's a real opportunity to work together. Countries often, we have to respect the fact that member states, of course, are responsible for what they want to do on vaccination. Having said that, everyone wants to do the best for their population, and while there may be slight changes in your demographics or reasons for doing things one way or another, there is a lot of alignment and countries can really work together well. So we see these examples of these joint actions and programs. We have moved in recent times more towards sort of looking at vaccination also applied to, for example, preventing cancer, or now coming up preventing cardiovascular diseases. So these are sort of like new areas where we'd like to see this type of cooperation between the countries, because these are really sort of the big challenges where we can really make a difference together. Yes, so that's targets. Well, as I mentioned, there are some, but targets also, we need the support, right? Not just the number. So, but yes, I would say mostly positive from what I see, from what we have happening at the moment, or plans ahead. I see a lot of cooperation that is happening and is going to happen in a lot of areas where this is really a European added value. I think the countries participate because they feel that. I hope Paulette agrees, but this is at least how I see it. Thank you.
Thank you very, very much. Any other comments to this question before Paulette?
I was just thinking, Rita, did you think about when you made the high targets of 90% and for cervical and for HPV related cancers, that you might push the agenda of the one dose vaccine, because we all think that, okay, we can all reach the target if not all, but more of us can reach the target if we have only one vaccine dose, because it's a very, very ambitious target. So a lot of us was actually thinking, so did you cooperate with Sabrina and the ECDC on this issue, or with the very high targets, and maybe on their view on the one dose off label. Thank you.
So I'll have Rita answer, and then maybe I'll give the floor to Sabrina. If you have any other
Just
thoughts.
very briefly, we always work together with ECDC, that is for sure. About things such as the one dose, I mean, that is not, of course, I cannot provide expertise on that, because that's not for the Commission to say, although it's interesting to see these considerations. I understand that the targets are ambitious. I think that they always are. And we want to really push ourselves to do as much as we can. But we know it's not an easy ask for sure to achieve these numbers. But I think that we have to push as much as we can together. But yes, recognizing nonetheless that this is a lot of work for the member states. These are ambitious targets, and I love to see the work that is being done at national level. I think it's really congratulations on that.
Yeah, it's really interesting. The particularity of vaccines is that they confer individual level, but when they reach those targets, they confer a collective benefit as well. So really interesting to flag that. Sabrina, I don't know if you wanted to add anything on the one dose HPV.
Yeah, I think that's just to note, in fact, what Violetta was saying, that in fact, if you look at the first dose, actually we have 7 countries meeting this, and I think Denmark, I don't remember the numbers now, is probably one of them. So really noting the complexity, that as the program is more complex, it might be difficult to push the line. At the same time, it's true what Rita says, that the targets are set to be ambitious. They are set, to push us to the maximum that we can do for the benefit of our populations. I also noting from the reflection of Rita Boletta, that is something that we continue to, this mutual exchange that we have all the time with the Commission, with the countries, is something that really helps building to share the information, also how to progress, what are the challenges, what are the good examples, and also how to build further this system. So we haven't touched much on the importance of surveillance. That is really the first element that help us to describe what is the situation, how has the situation evolved over time, and also the efforts that the countries are actually doing to bring, let's say, the surveillance to the next level. We are always asked to be more timely, more granular, more, also easy to understand. So these are big efforts that are ongoing, and of course we're all committed to further work on them from our perspective of the CDC, working with the countries, protocols, experiences. But of course there is also a big investment from the Commission, from the countries in trying to map this, all the information we have further. And I think we have touched upon some of the studies. I think it was Lyudmila really remind us some of the studies that have described how the incidence of some of these diseases are being described over time, how these diseases are changing. And of course, this is an investment that also not only national public health authorities, but academics are doing. And it's so important to really continue to describe how vaccine preventable diseases epidemiology is changing. And also something that we continue to need to do, because as a definition, we see that when these diseases that we are vaccinating for are diminishing in entity, in frequency, we tend to forget them, right? So then it is a continuous race for all of us, to remember of the importance of these diseases, why we don't see them. And of course, scientific community help us in this regard.
Thank you very much, Sabrina, for this great answer. Before I go over to Ludmila, a reminder to everyone that you can put your questions in the chat box, and we have a bit more time for your Q&A, so we look forward to your questions. Ludmila, over to you.
I'm sorry, but probably I have to say about our strategic group of experts on immunization that recently recommended that countries can use either 2-dose or 1-dose HPV immunization vaccination schedule. And they based their recommendations on the data that's currently available on the efficacy and duration of protection. They recognize that the data to support 1-dose vaccination may be not exhaustive, but they are sufficient at this point to recommend countries to consider is as alternative off-label vaccination schedule. And it, of course, will help countries, will make the programmatic aspect of vaccination easier, and will help some countries with lower income to introduce vaccination because it will be twice as cheap. But apart of European Union, you probably know that UK recommended 1-dose HPV vaccination schedule in their immunization program, and the country that most recently did that, I think it was Canada. And it just like for NITACs who are considering that, we conducted a training for NITACs on this topic, how to use systematic approach, and we asked our Canadian colleagues from NACI to present their data and how they collected and interpreted them. So if you are interested, they published their most recent literature review and all the important criteria that they considered when they were making this decision. Thank you.
Yeah, thank you so much, Ludmila. Yeah, I remember it was around 2024 that Canada introduced the 1-dose vaccination schedule for HPV, and the intent was quite explicit. I remember reading it was literally to facilitate uptake so that we wouldn't have to bring people in for a follow-up second dose. So very, very cool that we have some preliminary intel on how this is going from the countries that have applied it. I have a next question now for Sabrina. We're going to shift gears from HPV to pertussis. Different population that is generally affected, but the data on pertussis shows that there was a dramatic rise in 2024 compared to previous years, including when we look before the pandemic. What is this rise attributed to? What do we understand about it, and what have we learned from it?
Yes, thanks a lot. Hello, yeah, you hear us? Yeah. Indeed, Sarah. So what we've been monitoring pertussis for more than 20 years at the EU level, and what we saw in 2023 and 2024, the recent official granular data that we have is for 2024, is really a dramatic increase. And actually, ECDC reported on this also at the time of the outbreak, but now we have more granular data that we are able to describe. So first of all, and I mean, in terms of the number of cases, really what we saw in 2023, 2024, we have seen a 73% increase actually in 2023, and 2024, I think it was a 6-7% increase with 2023. So basically really dramatic increases in the number of cases. What is first of all, we have to think about want to say a couple of words on pertussis as a disease, a disease that can be very severe in young infants. We are talking about complications that can lead to death in these infants, and also we're talking about a disease that sometimes is difficult to recognize. It's not the first disease that comes to the attention of clinicians and even maybe us as parents, and it's also a disease in the older population. Actually, can you hear us? Yes, you hear us?
Yeah, you're online.
Yeah. The older populations may present with a typical sign, and so not the classic intense cough. Maybe it could be a more severe cough at night without fever. So clinical presentation can be heterogeneous. So this is the starting point, also because it's important to understand that since the presentation can be different, it's also captured in a different way by the different surveillance systems, depending if the surveillance system of a country is more based on the children, or maybe has some type of methods that can confirm the presentation, confirm pertussis itself in the adults. Noting that, for example, when you see this severe cough in young children, maybe the parent would go quite early to the doctor. Well, actually, for adults, you would wait a bit longer. And then you end up, to the doctor a bit later. And then the type of testing that you have to use actually to diagnose pertussis is different. So this is something that we were aware at all times. And that continues to be important to also understand the epidemiology of pertussis at EU level when we look at it from a 30-country perspective. What happens during the COVID pandemic is that, of course, we had restrictions, we had less interactions of individuals, and some sort of boosting that was happening in the population from pertussis that does not necessarily present as a severe disease in all the individuals stopped. And this probably coupled with some waning immunity and some absent immunity on the population have brought us to this big increase that we saw in the last couple of years. We know that pertussis goes in peaks and in waves, 3-5 years, and we were, a peak could have been expected, but this, of course, was missed because probably of all these different reasons. Something that we see from the recent, let's say, more granular data that we were able to look at is also that the testing practices seem to have changed. Of course, we don't have a specific study looking at that, but we could also think that they might be changing because of how we approach testing during the COVID pandemic. So from the data that we have at EU level, we saw an increase on some specific type of testing. So maybe there was more clinical suspicion in some groups, especially in adolescents. We saw some countries we had quite a number of adolescents diagnosed with pertussis. What else to say on this? Something that remains important is that we have pertussis vaccination programs in all EU countries, and in 25 countries we have also a maternal program with the aim of transferring, so receiving the vaccination during pregnancy and transferring the antibodies to the infant. This is really something that has shown in a number of studies. This is really accepted worldwide now. That is a key element to protect the infant, because usually the infant would have the first vaccine at the first or second or third month of life, and actually it's really would really not be covered, let's say, during the first 6-8 weeks. The opportunity of the vaccination during pregnancy really gives an opportunity for the child to be protected during this time, and it's something that we looked at as a very effective intervention. There was a question in the chat actually on what is the uptake of this vaccination. This is really very different in different European countries, and again here also the delivery setting, the vaccination as a whole is important. We often see it where we have a vaccination program that maybe has high coverage for other vaccination in pregnancy, like in the flu. We also see that this high vaccination coverage would also be for the pertussis program. Maybe I stop here. Yes,
it's really interesting. Clearly multifactorial.
Yes. Yes, stop here.
Thank you so much for that really comprehensive answer. We have time for maybe 1 or 2 more questions. So we just got a great one from Paolo Cardone. We're going to switch gears back to the HPV question. So Paolo writes, regarding the effect of 1-dose versus 2-dose HPV for the HPV vaccine, isn't there a risk of negatively affecting the trust towards the science and suggesting a strategy that might be easier to implement, but might lead to lower protection against cervical cancer? He has in mind the reaction to the COVID vaccination and the mismatch some people felt because they thought it would prevent infection, not just, I'm assuming he meant not just reduce the severity of the infection. Any takers for this question? Basically, how to navigate public trust in a change of schedule with a slightly reduced efficacy. Bolette, and then Sabrina.
But
Just a
we
moment.
did, yeah, thank you. But not that we have used the one dose schedule, but we have changed other parts of our schedule. And what we've learned about the HPV crisis, and also used that through the COVID pandemic, is what we call radical transparency. You need really to be transparent in your communication, and also be transparent about the unknowns. So maybe that you do think, building on Ludmila's evaluation on the WHO recommendation, that actually we do think it protects us well. And we do think for the main outcomes, it might be as good, but there might be these areas that you cannot answer specifically, and you need to be transparent about this. So we do this, and we do this because we believe it. And we believe it to be as good, but it is true, there are these areas. So that would be my take on it, that the radical transparency on any level.
Goes back to the fact of being very transparent about facts, like having access to quality data and information. Sabrina?
Yes, basically, just wanted to note on what Bolette was saying, and basically also the experience we'll be having at the ECDC is that really this big investment in being transparent, in communicating the changes, cannot be underestimated. So this is really a big investment that it needs to be done and adds value to the success of the change. Maybe this also a new vaccine or again a change. Could be also change of the time when you give the vaccine. This is really something that can be felt as drastic actually by some, and so really big efforts needs to be taken in this regard, and also understanding that for some vaccinations, there could be different aims of the program depending of the country, of the setting. So and the objectives of the program can change over time as well.
Great, thank you so much. Rita, last word on this question. Oh, and then Ludmila, last word on this question after that.
Very briefly, just I really just want to say what Bolette and Sabrina already said about transparency, and just to remark on how things have, how much we've learned from the COVID pandemic, I think, in terms of that. I think really, I mean, it was difficult times for all of us, and things were changing quite quickly. So it's natural that people were often feeling a little bit confused. But we've really, I think all of our organizations have learned the importance of just really giving very transparent, open information, and really, yes, not try to oversimplify things or try to skip over the procedure, but do the opposite and really take people along so that they can also understand exactly how things are done.
Absolutely. Thank you so much, Rita. Last word to Ludmila before we go to our closing remarks.
I just wanted to clarify that we can't say that protection with one-dose vaccine is a little bit lower than with the 2 doses. We can say that we don't have exhaustive data to be absolutely confident, but the data that we have right now are sufficient enough to say that it's not less than 2-dose protection, and it lasts also, we already have, if I'm not mistaken, protection lasts for 11 years, but currently there are studies conducted which are, let's say, gold standard studies that compare vaccination with non-vaccination, because in the studies for 1 dose, we mainly compared 1 dose with 2 and 3 doses. That will be available soon, and I think this also will help countries to again decide what kind of vaccination schedule they would like to introduce in their countries. Thank you.
Yeah, absolutely. This reminds me during the pandemic as well that, the guidelines and recommendations had to evolve as the data evolved. So once we established that it was safe, then we had to say that we know that it does this well enough, so we move on, and then we adapt and adapt as the data continues to be accumulated and analyzed. So I think to a certain extent, hopefully the public has a flavor of experience with, adapting recommendations to available data in live time, so to speak. So with that said, I am going to move on to the final part of our event, which is our concluding remarks. Before I open it back to each of you, I want to thank you so much for your great answers, your expertise, and also a massive thanks to our audience for their phenomenal engagement and really great questions. So I'd like to do a quick round of closing remarks from all of our esteemed speakers. So we'll just have you back on stage. And I just want to hear from you what your key takeaways are from this event and the things that you'd like to carry forward for the rest of European Immunization Week. I'll start left to right on my screen with Bolette.
Yes, thank you so much. I think it's been a phenomenal event, and I think just as maybe you pointed to as well, Sarah, that getting all of these stakeholders together and communicating with one voice is very important. So my take-home message is that there is a lot of good things going on in Europe. We are very ambitious. We have high target aims and still have a lot of work to do. And I think that focusing on communication and on the vaccination through all ages is very important, and I'll keep that as one of our target goals also nationally for the coming year.
Thank you so much, Bolette. Sabrina, key takeaways from you?
Yes, I think from my notes, and I think it's really reflected also in this nice discussion we had with our different profiles, is that when we have to think about the vaccination as a continuous effort, but not because we don't like it, but it's because it's a continuous investment. We have to put at different level, and this is continuous because there is evolving evidence. It continues because when we really meet these targets, then the diseases tend to disappear. So this is something we need to continue to do. And I also want to note again, as mentioned before, the importance of the frontline healthcare professionals that are with us today. They are really making the difference. So this is really what we are looking at, and look forward to further engage through our studies and our courses and everything, because they are really the ones that can make the difference. Thanks.
Thank you so much, Sabrina, for your insights and these closing remarks. Ludmila, over to you.
Thank you very much for this opportunity to participate in this really excellent event. And for me, the take-home message would be, it's not maybe the easiest time for immunization programs globally, because anti-vaccination movements are activating. There are a lot of contradictory information about vaccines in mass media, in the internet. And I wanted, for me, it's important to point out the important role of medical workers in addressing this situation, in ensuring that we maintain high immunization coverage or even increase it to achieve this real ambitious control and elimination goals. And many studies still demonstrate that despite the fact that people look for this information in the internet and social media, discuss it with their friends, but the final decision they make based on the medical worker recommendations may not necessarily be GP, it could be nurse, it could be some doctor that treats my father's cardiovascular disease. But that's why I would like, for me, it's very important to remind medical workers about your important role. And our task is to equip you with the knowledge, with the tools, with the necessary skills, so we will work together towards improving national immunization program, increasing coverage, and reaching the ambitious disease control and elimination goals. Thank you.
Thank you so much, Ludmila, for sharing your time and expertise with us. And Rita?
Yes, so I would say my takeaway in an event like today's is the importance of communication, that there is a lot of work, great work being done, and that we really must keep our citizens informed and engaged. And what I would like them to take away from all of what was said today is also the, I guess, theme of this year's Immunization Week: for every generation, vaccines work. So the key word being life course, because at different stages of life, there may be a vaccination for you. If you have a health condition, ask your doctor. Or for happier life events like pregnancy and travel. So it's an easy means of protection that we should all be profiting from.
Fully agree. Thank you so much for sharing your time as well. So that's all the time we have. I want to thank you all for such a rich and thought-provoking discussion. What really stands out to me from today is that vaccines remain one of our most powerful public health tools, and it's no longer just about developing effective vaccines for every stage of life. It's about ensuring trust, improving access, and making immunization work for everyone across their life course. It's also about taking stock about the successes we have achieved and continuing to build on those best practices. And I've been personally quite inspired by the progress made in HPV vaccination and in hepatitis B vaccination. We also heard that there is work to do, tackling misinformation, disinformation, increasing public confidence. We learned some key tips and lessons on how to organize a communication campaign to rebuild trust in vaccination, as was done in Denmark. So thank you, Paulette, for that. And we also heard about the need to increase vaccination coverage among key populations. I'm thinking about the Hep B vaccination among infants and healthcare workers, and the need to sustain that coverage in countries that already have a universal vaccination program. But perhaps most importantly, I think you really all touched on this. We're reminded that success in immunization really relies not just on science, but on people. It depends on healthcare professionals, policymakers, communities, and really all of us working together to achieve our, albeit ambitious, but necessarily ambitious targets. So I'd like to join you all to thank you all for your insights and for contributing to this event, which was organized by the ECDC together with DG Santé, the European Commission, and the World Health Organization's Regional Office for Europe. Now, as we mark European Immunization Week 2026, I hope that today's conversation serves as a reminder and also as a call to action to continue strengthening confidence in vaccines and really ensuring that nobody is left behind for today and for all the generations to come. Now, before we part ways, just a couple of last encouragements. So the first is please check out the immunization dashboard. If you are a lover of data and numbers and facts, this is going to be your treasure trove. I personally love it. And we also would like to extend an invitation to you. So I'd like to invite you all to join us tomorrow for an ECDC Lighthouse webinar called From Hesitancy to Acceptance: How to Use Empathy to Respond to Vaccine Misinformation. It's happening from 1 p.m. to 2:20 p.m. CEST. And we really hope to see many of you there. And I think we'll pop the link to the event in the chat box over here. So with that, I want to thank you all so much for joining us today. I hope that you enjoy the rest of your day and the rest of your immunization week. And with that, I'd like to wish you a great rest of your afternoon. Goodbye.